Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Seasonal Affective Disorder or the Wintertime Blues? Which could it be? Both have to do with being discontented. Heard the saying, now is the winter of our discontent? Shakespeare and John Steinbeck both talked about that. But what we want you to do is to identify any discontent and change it to the winter to reinvent some of your behaviors and things you can do with your kids. So, seasonal affective disorder and wintertime blues. Symptoms: feeling unusually sad or irritable even when there's no obvious reason, losing interest in things, low energy level, changes in weight or eating habits, sleeping too much or too little, and being very self-critical. Now, SAD often makes the person non-functional because they are more likely to have self-harming behaviors like cutting or even attempts of suicide. If you see anyone in your home or elsewhere that is having depression, you want to be sure and get them in or have them see their doctor. So SAD is actually a form of depression. The definition means that someone's had it at least 2 years and it is extreme. Wintertime blues often can come if there's a stress or something going on in somebody's life and can be debilitating to some extent, but usually not quite as much. So what should you do? Well, there's something called behavioral activation, and it's exactly the opposite of what we want to do. We want to sleep. We want to just kind of stay in our own little environment. What we need to do is to get out, and we need to be sure and get some sunlight for that melatonin and serotonin balance that seems to get off in the wintertime. We need to eat right, we need to exercise, and we just need to get out and do stuff. So make this the winter to reinvent your relationship with your kids and their health. Give that kid a hug.